opioid settlement meeting. We're required to do this meeting once a year. And we've invited our three municipalities, that being Henderson and Middleburg and Kittrell. And I believe just so you know, Henderson actually did their own settlement. So they got their own part of the funds. And so they're not part of the Vance County settlement part. They did their own thing. So Renee, I'm going to turn it over to you so we can do all our statutory requirements.
Okay, absolutely. Well, welcome to Vance County's 2024 annual opioid meeting. As some of you may or may not know, the state of North Carolina, as well as all 100 counties, joined in with a national settlement to bring litigation against several pharmaceutical companies. The MOU requires an annual meeting of counties and municipalities within each county. Each county receiving opioid settlement funds shall hold at least one annual meeting with all municipalities in the local government's county invited in order to receive input as to proposed uses of the opioid settlement funds and to encourage collaboration between local governments both within and beyond the county. These meetings shall be open to the public. Today's public comment period is only for the municipalities in attendance. If the Board of Commissioners agrees to invite any other organizations that are interested in providing input, a group collaboration planning meeting will take place before the end of the calendar year. There is no Q&A today. We are only receiving input from the municipalities and from any commissioners in attendance today. Okay. So just to look at the agenda real quickly, so we'll go through the state of opioid and substance abuse in Vance County, opioid settlement progress report, as well as community and stakeholder input, which is the municipalities. Okay, so for this slide, I reached out to our health department to obtain some data as it relates to the crisis in our county, and this data is from the North Carolina Department of Health and Human Services. It shows the substances that contributed to death here in our county over a 10-year period spanning from 2012 to 2021. You can see the dark blue line for heroin, and for fentanyl. The other two blue lines represent cocaine and alcohol. The green line represents commonly prescribed opioid medications. You can see the huge increase in heroin and fentanyl over the time period from 2012 to 2021. And I'll have, I can get these slides out to anyone that's interested after the meeting today. Okay, so the next slide, this chart shows Vance County fentanyl positive deaths since 2021. So from 2021 to 2022, there was an increase from 6 to 11 deaths, and this is in Vance County. From 2022 to 2023, there was a decrease from 11 to 4 deaths. From 2023 to August of 2024, there was an increase from 4 to 13 deaths. This is huge because 2024 still has 4 months that will be reported. This chart also shows the demographics of those that are deceased. The majority are Black, non-Hispanic males with an age range from 25 to 34 and 45 to 54. So the next slide shows how much North Carolina state and local governments will receive over the 18-year period. There is a payout of over $1.3 billion going to fight the opioid crisis in our state. The payments were heavy in fiscal year 23-24, and they will decline over time. Okay, so the next slide shows how much Vance County will receive over the 18-year period. There is a payout of over $6.2 million going to fight the opioid crisis here in our county. The payments were heavy in fiscal year 2023-24, but of course they will decline over time, just like the previous slide. Okay, so to date, the county has received a little over $1.8 million with $0 dispersed. These funds are set up in a separate revenue fund and cannot be commingled with any other county funds. We've had a few opioid committee meetings, but there are no plans in place just yet for Vance County's opioid funds. Proper planning will be key because we want to ensure that we use the funds wisely and reach those that need the help. As stated earlier, we plan to start planning before the calendar year ends. Okay? So the MOA offers local governments two options. So option A, a local government may fund one or more strategies from a shorter list of evidence-based high-impact strategies to address the epidemic. Option B, a local government may fund one or more strategies from a longer list of strategies after engaging in a collaborative strategic planning process involving a diverse array of stakeholders. Okay, so option A. Vance County chose option A. So in keeping with the National Settlement Agreement, opioid settlement funds may support programs or services listed that serve persons with opioid use disorder or any co-occurring substance use disorder or mental health condition. And so option A has high impact opioid abatement strategies. So it can be evidence-based addiction treatment, recovery support services, employment-related services, post-overdose response teams, criminal justice diversion programs, and reentry programs. I won't read all those out. And option B had some other remediation activities as well. So I'm supporting people in treatment and recovery, connecting people to need the help to get the help that they need, addressing the needs of the criminal justice involved persons, prevent misuse of opioids, and so on. That was quick. So, of course, that's the end of our presentation for our annual meeting. But we do want to invite the municipalities or any commissioners here to provide any input or feedback that they have today.
Do commissioners have any comments?
No.
Refresh my memory. Do we have, under either one of these options, but I'm talking about our county right now, do we have a committee or something in place to determine, and if we do, have they made any determinations on where they think the money in Vance County should go?
So we do have a committee, but there have not been any determinations yet. And on that committee,
Met.
Yes, sir, we have. I think we met maybe a month before last. And so at that meeting, we decided to do an additional meeting before this year ends to figure out what direction we want to go in.
When that committee meets, does the public know they're meeting?
Yes, sir.
So it's a public announcement that they're meeting. They know when and where they're meeting.
Just like any other committee meeting. Yes, sir.
I take it the committee has diversity
Yes.
in terms, could you
Well,
tell us?
when you
what
say
the
diversity-
looks like?
Well, actually, it's Yolanda.
Talking about, when I talk about diversity here,
Mhm.
I'm talking about different age groups, different, of course, ethnic groups,
Mhm.
but also people who have been on drugs and this sort of thing, but have recovered. And so they know what it's like to have been on drugs. They know what it's like to, are some of them on the committee?
So it's a two-part answer. So the commissioners, well, I think when Yolanda was chair, there was an opioid committee that was established. And so it's Yolanda, Sean, and Carolyn on the county's opioid committee.
Sean and
Carolyn, Commissioner Faines. And so when we met before, they decided that they wanted to do a collaborative approach in which we invite organizations throughout the county. So it could be someone that that has a lived experience, or the health department, or EMS, or sheriff's office. And so we will have diversity once we get to that point.
so what I'm hearing is the board's committee does not have the kind of diversity I was talking about.
Correct. That's correct. Yes, sir.
That we could take another look at that board to make sure the committee that the board has established. That kind of
Absolutely. I could bring that to the commissioners for you all to check. Yeah, absolutely. I would agree with that as well.
I think our appointed board, Mr. Chairman, should have more than just commissioners on it. That's what I'm saying.
That was the decision that Yolanda made. And I
Mhm.
support that. I believe a lot of these committees, just from looking at what other counties have done, they've ended up with 25 or 30 people and that kind of thing.
Well, no, we don't, I didn't say a number. I'm not interested in the number. The number can be small. It can be no more than 5 people or whatever. It can be 3, but at least one of them, I think, ought to have been someone who has experienced the problem, recovered from the problem, is now able to help the board understand where these things should go.
I think
Right now, we are talking, we got three county commissioners on this committee. And I think that we need a a little more diversity in terms of people in the community and that sort of thing, at least 2 more people.
The commissioners will be reaching out to other groups who have lived life experiences and so forth. And that's a part of the plan that I heard because I attended their meeting.
Mhm. Yep.
So
Yes, sir.
the idea is to involve those type of people you're talking about.
Okay, so let me go back to why I'm saying what I'm saying. When you reach out to other people, they come and give us advice based upon their expertise or what's going on in their area. But they don't get a vote. Only the committee gets a vote.
So at the
And
end of the
that vote
day,
is only 3 commissioners who have no experience or no backgrounds in this.
At the end of the day-
No.
at the end of the day, it's the full board will make any decision that will do. That's based on the way the system is set up.
But they will make that decision based on a report from the committee. And the committee needs to have some sort of diversity. That's my opinion.
Okay.
Now, we can bring that up before the board as a whole if you want, but that's where I am on that.
Well, I mean, that committee was appointed by the chair and I'm the chair now. And right now, I don't have any intention to change what Ms. Phipps started.
Okay, I hear that.
Renee, I'd like to ask, I didn't have a question before. Can you give me any in terms of what surrounding counties are doing in terms of committees and what you have gotten feedback as to what's going on in, some of the surrounding counties?
I can only speak for Halifax when I was there, because I helped, establish the committee. So the committee consisted of, deputy county manager, someone from EMS, someone from social services, someone from the health department. And I believe there was someone from, I can't remember the other department, but the departments that actually, are with, that population. Yeah. And that understands it. And I would agree that we do need a little bit more diversity on the committee. We talked about that at our committee meeting, but we really didn't make a decision on how we need to move forward. I think the committee meeting actually was, I think we were all over the place trying to determine what we wanted to do, but that was one of the recommendations. I think Commissioner Austin said, just bring everybody to the table. I didn't agree with that because it may be too many people at the table at one time. I actually recommended a subcommittee in which we have EMS, we have the sheriff's office, we have those departments that have the experience and have seen it day to day. So to be honest with you, I can't really say that we finalized what we wanted to do. I would say that.
That's
Mhm.
Halifax, so.
Yes. Mhm.
So it's a committee in
No.
in progress, right?
Well, I'm sorry. I guess I mixed my thoughts. I'm sorry. I apologize. No, Halifax had EMS, they had the health department, they had social services and county management on their panel, and the hospital as well. That's right. The hospital was a part of it. But here, we haven't necessarily decided who we want on our subcommittee or the bigger group of people
Well, the committee, that subcommission, are they leaning toward a subcommittee?
here.
Uh-huh.
I can't really say I want to call it a subcommittee. They were leaning towards just an entire group of people having the opportunity just to speak. I think that's the direction we went in, but I'm not necessarily a fan of it
Go back
because
to
it may be too many
Halifax, when you
people at one
speak to
time.
Halifax, what have they done? What have they done thus far?
As far as their funds, I'm not sure. I can't remember. I've been gone for a year, so I don't know. When we left, we were talking about Narcan machines, which I think that was thrown out the window because that wasn't needed anymore. Trying to remember what else. We hadn't really spent any funds when I left last November, so I don't know where they are in the process, but I can do some research for surrounding counties and I can get that information back to you all to see what they're doing with their funds. It's actually on the dashboard, I do believe. Yes, on the
Follow
dashboard.
up on
Mhm.
what Commissioner Kelly is saying.
Mhm.
I think
Yeah.
what he's saying is appropriate.
Mhm.
We should see what other counties are doing. Halifax sounds like what I'm talking. Broader committee with diversity of people with experiences. And I think Commissioner Kelly is right on that.
Yeah.
See what other comments are doing. Our committee seems so inadequate to me. And then after we talk about that, maybe we should put this, since our chairman doesn't want to change anything, maybe we should put this as an agenda item on our next board meeting to have a discussion about what should be on this committee.
As I listen to the discussion,
Mhm.
and I hear what the chairman said, as I delve into it and everything in terms of subcommittee, I think that you need to have a committee that has input or that can lend its suggestion to the committee, because those are folks that are out there in the field.
Boots on the ground.
Unfortunately, I'm nothing against the three people that are on that do not have experience in terms of dealing with, in terms of Dan, in terms of being real involved and everything. But I think the experience in terms of where the rubber meets the road, you need to have some folks that are out there that rubber meets the road that deal with it. Carolyn's in a different setting, Yolanda's in a different setting, Dan's in a different setting. So I think that having input either through a subcommittee or involvement on that committee would be advantageous to us. That's just this commissioner's thought, okay?
What I got from the meeting of the committee was, they do want to do exactly what you just said.
Okay.
They want to involve community organizations and people with life experiences, those kind of things, in order to make the evaluation. And that was the intent.
Okay,
That's what I
okay,
heard.
I can live with that.
Yeah, and I understand that. But at the end of the day, the committee is gonna make a decision based on what they've heard from everybody out there. I got that when we talked about it. They're gonna bring in outsiders to help them make decisions. But at the end of the day, the committee, three people are gonna make a decision on what they're gonna bring to the board. And I would like that decision in terms of a vote, because the committee will vote on what they're gonna bring to the board. I would like to have some, insights on what a total board consisting of big diversity has to say about it, not just three commissioners on a committee.
I'll work on doing some research and getting information off the dashboard about surrounding counties and what their plans are. I'll get that out to you all. Okay.
Any other business?
Like the Halifax committee.
Any other business to come before us now? Any other comments?
Anything else?
Well, that concludes our annual meeting. We appreciate y'all for being here. And we'll look forward to our next committee meeting